Hello, this is Dr. Wells from Wells Medicine, and a question I get pretty frequently is, can Wells Medicine do this treatment? So we came to the menu of interventional treatment options that we offer after very careful research of the literature and discussions with our patients and with our referring psychiatrists as to what would be the most helpful, meaningful, and fast-acting options to offer. That does not mean that they are the only options available to patients. So as research continues, there are a lot of really cutting-edge options, and we continue to explore those and to add them as we see the need develop. So we have been really fortunate to be a part of a very research-focused psychiatric community in Houston, between both Baylor and UT Houston. They are highly active, very cutting-edge research institutions, and because of our involvement with them, we've been placed in contact with other highly active research-focused institutions, and so we've been asked to do some procedures through the last 11 years that have been even more cutting-edge than what we typically offer. So for example, we've provided propofol infusions for migraine patients at the behest of a local neurologist, which has evidence-based published research showing that it can be helpful. We have provided scopolamine infusions, which was fairly challenging to get a hold of, but it was at the behest of a very good friend who's a psychiatrist in New York, and the patient had absolutely tried everything, including the ketamine and the TMS and the stellate ganglion and the nitrous oxide. And we were happy to work on acquiring and providing scopolamine for the patient. We have been asked and are in discussions with providing sevoflurane isoelectric infusions for patients. We have provided sphenopalatine blocks for migraine patients. I have personally provided anesthesia for electric shock therapy, although not at Wells Medicine. So we're very interested in providing research and evidence-based cutting-edge treatments. And so if there is something that you come across in your research, and a lot of our patients are very adept researchers, or there is something that as a psychiatrist you've been seeing papers on and you would like to find a clinical partner who is willing to go the extra mile to find that cutting edge treatment and figure out how to safely and comfortably administer it. Wells Medicine has been doing this for 11 years, and we look forward to continuing to offer the most cutting edge and most efficacious treatments we can.